What?
I'm just kidding.
I'd like to call the hearing of the Subcommittee of the Department of Operation, Oversight, Nutrition, and Forestry together to examine new and innovative ways to improve nutrition and wellness programs that will come in order. And I state this is to improve nutrition and wellness programs will now come to order. I'll begin by my opening statements. I'll first introduce myself, and then I'll talk about Jeff Fortenberry, Congressman. So I'm Congressman Joe Baca, Chair of the committee. I'd like to welcome each and every one of you to it. And as I stated before, this is on improving nutrition and wellness. This is not about the health bill. Just wanted to remind everyone in the audience that's here. I'm pleased to be here in Lincoln with my friend and colleague, Jeff Fortenberry, to learn about some of the innovative ways the committee and businesses are working to improve nutrition and health in America. I'd like to thank Mr. Fortenberry and his staff who have done a tremendous job of putting together an impressive list of witnesses with experience in ways to improve the lifestyle and prevent lifelong disease. And I really want to say to Congressman Fortenberry, thank you for bringing Washington, D.C. to Lincoln, Nebraska. We believe that this is part of history because I don't believe that there's been an ag hearing right here in Lincoln, Nebraska. So I want to thank you, for being part of the historical perspective and the concerns for Nebraska and the citizens in this area, and saying that it's time that Washington came to Lincoln, Nebraska, instead of Lincoln, Nebraska going to Washington. So we're now here in this area. So thank you very much for making part of history and bringing it back to the people right here. The topic of great interest to me as a legislator, a father and grandfather and community member. I'm quite active and care a lot about this particular subject as an individual that believes that we can increase life through wellness and nutrition and appropriate diets. And then, of course, as I see the gym and the activities that you have here, and then, of course, back in Washington, D.C., I do a lot of bipartisan. We play a lot of basketball. We play golf. We do a lot of activities that I think it's good for a lot of us. Any form of activity is good in terms of the wellness. And then, of course, the fresh fruits and vegetables and eating right is important to a lot of us. My district, I come from San Bernardino area. It's similar to Lincoln in terms of almost size. But we also have something that's in common, and that's the area in terms of health and welfare of our communities and our nation are almost similar. I'd like to state that some of the statistics I've read about point to how much we have in common between Lincoln, Nebraska, and San Bernardino. And according to the Census Bureau, the rate of diabetes in Lincoln County and San Bernardino County, where I come from, are not too far apart. They're basically about the same. So diabetes impacts a lot of us when we look at diabetes and overweight and obesity and its impact on our nation, our country, and especially the cost factors that we'll talk about through the panelists and witnesses that we have here. Over the last 4 years, the Subcommittee on Health and Agriculture Committee as a goal has built a record that links the importance of nutrition and health. And I think that we've got to look at nutrition and health and how it's tied together. And in the 2008 Farm Bill, we provided a record level of funding for nutrition for safety net programs like SNAP, which is the old food stamps. Now we've got to learn to change the name. And of course, Congressman Fortenberry and I and others, who worked in that legislation and wanted to make sure that it was available throughout our nation. We also included in a provision of it is to make sure that we talked about nutrition, that it was available to all 50 states in terms of the schools, because before it was only available to 14 states. And it's important that we have good nutritional programs in our schools as well, because of a healthy body in school also leads to productivity in terms of learning, the ability to progress, and then attitudes and behaviors within the classroom as well. And I'm sure some of the panelists will address that, and we wanted to make sure that that was included in the Farm Bill as far as the nutritional aspect of it. And Part of the problem that we've also have seen is the importance of the changes that need to be done to promote healthy eating by funding pilot programs that encourage consumption of more fruits and vegetables, especially in America's schools. Last year in July, the subcommittee heard testimony on the economic cost of poor nutrition in the United States. Researchers detailed that hunger costs our country between $90 billion per year in loss of work, productivity, and the need for special education and other factors. Also, testimony from California advocates demonstrate how the lack of participation in federal nutrition program means loss of revenue for California, and that probably applies right here to Nebraska, is the lack of utilization of the SNAP program that will help, whether it's a senior, a disabled, or youth, is that we should take advantage of it, because that's federal dollars that also come back to the state, the counties, and in the city. That's additional revenue then that can be utilized if people also utilize the nutritional programs that are available through SNAP, especially for a lot of our veterans who are disabled and other individuals and our seniors. That's revenue that we're all losing because we're not using it, and yet it's available by the federal government. We need to take advantage of these programs to help stimulate and get over the negative stigma of being on food stamps or nutrition. And I'm an example of one, because I was on food stamps, and now of course we call it SNAP, and we have debit cards so you don't get embarrassed by going in front of a grocery store and pulling out your food stamps and someone's looking at you. But it's about healthy body, and it's about nutrition, it's about wellness, and it's about living a lot longer as well. And it's important that we look at these kind of programs, and I'm sure that Congressman Fortenberry and others realize it's important to the state of Nebraska in utilizing this for individuals that need to put food on the table and make decisions between maybe some of the foreclosures or loss of jobs that we have. But it's important that we look at it. In March of this year, the subcommittee took on the topic of obesity. We had a hearing in Washington, D.C. on obesity and, of course, overweight and the causes that are there. In obesity, the cost of the nation, it's roughly around $75 billion in direct cost each year. So that's a direct correlation when you look at this committee and the cost of obesity, of what it means to us. And then indirect costs, it goes as high as $173 billion per year. Can you imagine those amount of monies that we're spending just on obesity and overweight that could be utilized effectively in other programs to our states, to our nation, and what it is to us as taxpayers within our communities? And they project that if we don't do something in that area, that's why I really appreciate what Congressman Fortenberry is doing now in bringing this kind of an awareness to reduce the kind of cost, not only of the cost now, but the projections of what it will be in the future if we don't begin to address it today, if we don't begin to do something. And I'm glad that when I look back here to my left and I see the gym out here and the exercise and what you're doing here, it's very positive in terms of what we're doing to prolong the problems that will continue to exist if we don't do anything about it, because it's estimated that obesity and overweight could range from $860 billion to $956 billion by the year 2030. So when you look at those figures, that's a high cost to us. Who's going to pay? We, the taxpayers, are going to pay if we don't begin to do something in that area. And then, of course, more than 2/3 of American adults are either overweight or obese. The average American today is 23 pounds overweight. The burden of major factors is skyrocketing in health costs, as I indicated, and then, of course, the research that has been done in that area that tells us what it costs on a daily basis. This accounts for about 10% of all of the health spending in America, and is more than double that amount spent on obesity related to issues only a decade ago. Make no mistake, we must find real solutions to obesity epidemic if we are to protect the economic and physical health of the American people. And this is what this hearing is about here today. And again, thank you for bringing Washington, D.C., and making history in Lincoln, Nebraska. With that, I'm excited to be here with my friend. I know he's a strong advocate. I see him in the gym all the time working out, so I know that he really believes in what he says. It's important that when you're preaching that you practice what you're preaching. And Congressman Fortenberry is practicing what he is preaching because he is physically out there working out in the gym every day, knowing what it means to him and what it means to the citizens of Nebraska and Lincoln and district that he represents. With that, I want to thank Fortenberry for being here and the witnesses who agreed to be here today, and I look forward to hearing your testimony. So at this time, I'd like to turn it over to Congressman Fortenberry.
Thank you, Mr. Chairman. Well, first let me thank Chairman Baca for joining us today, for his willingness to hold this hearing in Lincoln, Nebraska. We're very honored that you would travel to our home, Lincoln, here to make history, as you said, and to review the important issues of nutrition, health, and wellness. Congressman Baca made mention that he enjoys sports. He's being a little bit humble in that statement. We recently had a congressional baseball game, and you're looking at the winning pitcher of that game. Now, he revealed to me, and I don't think he'll mind me saying this publicly, that he's 62 years old, and he was clocked at throwing between 62 and 72 miles per hour. So, congratulations, Mr. Chairman. I'd also like to give a little bit of background on our chairman. He has served in Congress since 1999, and he is representative of the 43rd District of California, which, as he mentioned, is the San Bernardino Valley in the southern area of the state. He is chairman of this subcommittee, which is an agriculture subcommittee on department operations, nutrition and forestry, and oversight, and I am the ranking member of the subcommittee. Chairman Baca formerly served in the United States Army as a paratrooper from 1966 to 1968, and following his military service, he earned a degree in sociology from the California State University at Los Angeles, and then for 15 years worked in community relations with General Telephone and Electric. He has served both in the California State Assembly and its State Senate, and he now lives in Rialto with his wife of 41 years. They have 4 children, and his son is the new mayor of Rialto, California. So again, congratulations. I'd also like to thank Marcia Lomo, who is the CEO of Madonna and Madonna Proactive, for allowing us to hold the hearing today. I called Marcia, and of course, this is a wonderful new facility that augments the extraordinary services that Madonna Hospital provides. And we thought it would be somewhat creative, given the topic of today's hearing on nutrition and wellness and health, to place it in the center of some very innovative activity that is going on in that regard. So, Marcia, thank you very much for your generosity in opening the facility. It's absolutely lovely. I also wish to thank the witnesses who are here today. For those of you in the audience who can stay with us, we actually have 2 panels, 9 persons testifying, who are all experts in the various areas of health and wellness and nutrition and health care. So I invite you to stay for our entire discussion, but certainly understand if you need to leave. Throughout the country, we are engaged in a very important debate about the directions of our nation's healthcare system. The debate is critical to the well-being of families and small business and to all of us as American citizens. And I believe our deliberations must be very thoughtful and center on 2 essential questions. How do we improve healthcare outcomes and reduce cost while protecting vulnerable persons? And one important piece of the solution is to understand that a major driver of our ever-increasing healthcare costs is the rise of chronic diseases, as alluded to by the chairman. We are seeing an epidemic in chronic diseases across the country. Public health statistics and economic data show that 75% of all healthcare spending in the country, and that's about $2.2 trillion of the total amount of healthcare spending, is related in some way to treating lifestyle-related chronic conditions. 7 out of every 10 deaths in the country are caused by a chronic condition. The top 4 killers are heart disease, diabetes, cancer, and strokes. And these are largely related to lifestyle. They could be potentially prevented, or certainly better managed, and in some cases even reversed through healthy lifestyle changes. But sadly, according to recent statistics, the average American is now 23 pounds overweight, Obesity among young people has tripled since 1980. Obesity is a major risk factor that leads to the onset of those described chronic conditions. I believe as a result it is imperative that our healthcare system promote and incentivize healthy nutrition practices and wellness. And we must foster a culture of wellness and reward behaviors that reduce the onset of these diseases. I believe that billions, if not hundreds of billions of dollars could be saved if we reduced or at least delayed their onset. As responsible individuals and citizens, I hope that we will personally implement wellness and preventative measures that can reduce our risk factors for these conditions. And similarly, I support a paradigm shift in the practice of medicine. In our country, we pay doctors to fix or cut or prescribe. I think it's time we pay doctors to prevent as well. So these are all reasons that we are gathering at the hearing today, and as ranking member of this subcommittee, I'm personally committed to exploring the ways in which good nutrition habits and wellness principles promote policies that support chronic disease prevention efforts. I'm eager to hear from our experts who are here today from across the state and the Midwest to speak on these topics, as well as to hear their suggestions as to what is working and what could be potentially duplicated throughout the country to promote this culture of wellness and chronic disease prevention. Again, Mr. Chairman, it is a privilege to have you join us, a real honor for you to be here in the 1st Congressional District, and I want to thank you again for holding this hearing, and I look forward to the insights that we will learn today together. Thank you.
Thank you very much,